My name's Lance Liberty, and I'll be your presenter for today's non-surgical knee pain relief solutions presented by Sound Integrated Medical Center, located in Federal Way, Washington. They can be reached at area code 253-205-8486 to ask any questions, verify your insurance benefits, or schedule your risk-free consultation. But we'll get to that again at the end of today's presentation. Before we begin, I'd like to define what we're here for. And the purpose of our workshop today is to provide help. We're going to be discussing some non-surgical treatment alternatives that may work for you, even if you've tried steroid injections, pain medications, anti-inflammatories, even surgical interventions without positive outcomes. Also, and I feel most importantly, is to share some hope with you. The reason I'm your presenter today is actually because I, like you, was in a situation with osteoarthritis of the knee. I had early onset osteoarthritis, told I was bone on bone, would need a knee replacement. At that point in time, I was very depressed with the prognosis and thought I didn't have any options when I was introduced to one of the original FDA-approved viscosupplement medications called Hyalgin through a client of mine whose father was a doctor of osteopathy injecting this medicine. And it helped me regain my strength and function and eliminate my pain when I was told that nothing else would work. You see, I had suffered a high school football injury. Blocking on a kick return, I got hit by a helmet on the side of my right knee and kind of fell backwards over the person that got pushed into me, and I tore a few major ligaments that required surgical repair. While initially I got my function back a few years later, I lost most of the function in that knee. So I went and got an MRI to see what was going wrong, and I was bone-on-bone contact medially on the inside of my knee and was told that knee replacement surgery would be my only option by both the radiologist and the orthopedic surgeon who was working on my case. Luckily, I got introduced to this injection medication, and it worked well for me and provided many years of pain-free relief. I had another round of injections done in 2013, kind of as a fill-up, if you will, and that's kept me good and functional for another over 7 years so far. So I've been sharing my experience with others, and actually that process began with a doctor who injected my knee almost 2 decades ago. I convinced him to leave his job working for an orthopedic clinic and open a practice focused on the non-surgical treatment of osteoarthritis of the knee. And in that facility is where we developed the Advanced Arthritis Relief Protocol. This is the treatment approach we'll be discussing today, which has now been trained and certified in over 200 locations in 38 states, including Sound Integrated Medicine there in Federal Way, Washington, with Dr. Phoebe and the rest of his clinical staff. So a little bit about your local provider. Sound Integrated Medical Center specializes not only in the non-surgical advanced arthritis relief protocol, but also in many different regenerative techniques, such as platelet-rich plasma, where we take a concentrated growth factor from your own blood to help to stimulate soft tissue rejuvenation in meniscal tears, rotator cuff tears, other orthopedic injuries, as well as other regenerative tissue therapies, such as mesenchymal stem cells, amniotic fluid, and also certain other medications that are non-steroidal anti-inflammatories used for hot spots that you might be having pain and suffering from, called trigger points and so forth. The facility has radiology on site to take x-rays, look inside your knee, see what's going on, as well as video x-ray to perform guided injections that guarantee and assure the medication gets into the knee capsule or the bursa of the shoulder where it's required for your treatment. But before we get into all those fine details and the risk-free consultation offer, I'd like to talk a little more broadly about knee pain. Knee pain is a very common condition in the United States. Behind back pain, it's the second leading cause of musculoskeletal pain in our country. And it results in over 700,000 people having knee replacement surgeries in 2013, according to the CDC. Last year, that number grew to over 1 million. Many people are told that surgery is their only option, but I'm living proof that that's not true. So why is knee pain so prevalent? It affects over 40 million people at any given moment in the United States. The CDC estimates that by 2030, over 70 million Americans are going to be diagnosed with osteoarthritis of the knee. It causes hundreds of millions of office visits, billions of dollars of expense to the healthcare system, and is the leading cause of disability in the elderly as well as loss of work. Osteoarthritis is the primary cause of most knee pain in the United States. It's a degenerative condition of the bones, joints, cartilage, and it can result in pain, swelling, and loss of function in the joint.